Hey, hello everyone, and welcome to the NCCEH's May Environmental Health Seminar Series. And today our presentation is entitled Extreme Heat Events, Media Communication with Impact. My name is Juliette O'Keefe, and I am a senior scientist here at the NCCEH. Just to note that the presentation portion of today's webinar will be recorded and posted online after the event. However, the question and answer period and discussion will not be recorded. Please make sure to turn your video cameras off and put yourselves on mute throughout the duration of the presentation. And you can type your questions that you have into the chat. We'll try to get to all of them that we can during the question and answer period of the webinar. Today, I am calling in from the traditional, ancestral, and unceded territories of the Coast Salish peoples, including the Squamish, Tsleil-Waututh, and Musqueam nations. I'm thankful to have the opportunity to live and work in this territory, and I recognize that many are calling in from different places around Canada, and invite you to take a few seconds to reflect on the traditional territories of the lands that you're joining from today, and acknowledge the work of the peoples who have cared for this land since time immemorial. Our speakers today are our own Rebecca Goulding and our former colleague, Anne-Marie Nicol. Rebecca Goulding, PhD, is an environmental health and knowledge translation scientist at the NCCEH. Rebecca is involved in knowledge translation and mobilization of a range of environmental health topics, including climate change-driven events such as extreme heat and emergency preparedness. Rebecca is an expert in evidence synthesis, systematic reviews, and medical science communication, with a strong background in health economics and outcomes research consulting. She has a PhD in genetics from the University of British Columbia and an MSc in oncology and hematology research from Trinity College, Dublin. Her interdisciplinary research experience includes a postdoctoral fellowship at UBC's Sauder School of Business, where she studied access to university-based innovation and intellectual property policy, as well as a role as primary health care research associate in the Faculty of Medicine at UBC. And I also have the pleasure of welcoming Anne-Marie Nicol towards the end of the presentation. Anne-Marie Nicol is an associate professor of professional practice at Simon Fraser University and a knowledge translation scientist at the BC Centre for Disease Control. Her research focuses on indoor environments and building resilience to climate change through community engagement. Currently, she leads the Breathe Project, a BC-wide program that connects at-risk communities to resources that improve indoor air quality. Dr. Nicol's training includes degrees in epidemiology, communications, and environmental studies. And I will now hand it over to Rebecca to start us off.
Hi, everyone. Thanks, Juliette. Welcome, everyone, and thank you for joining us today. So I want to begin also by acknowledging that I live, work, and present today as a white settler and an uninvited guest on the ancestral and unceded lands of the Coast Salish peoples, the Musqueam, Squamish, and Tsleil-Waututh, who have cared for these lands for countless generations. As I speak today, I reflect on what it means to live and work on these lands with respect, reciprocity, and accountability, and I recognize these responsibilities that come with being on this land, and I'm committed to ongoing learning and respectful relationship building. Okay, just to give you a prelude, and let me know if the audio isn't working at any point in the chat. I am monitoring it also. But here's an overview of what we'll be talking about over the next 50 minutes or so. I'll be going over some information about extreme heat events and how the media plays an important role in communicating about heat health risks.
Rebecca, are you sharing your slides?
Oh, apologies. Sorry about that. All right, can people see my slides now? Can you see my slides?
Yes.
Great, thanks. It just goes to show you practice it 5 times and still you forget to share your slides. Okay, so yeah, so following some intro. I'll be then presenting findings from a small study we did interviewing media professionals about their approaches to communicating about extreme heat events and the challenges they face and solutions they suggest to improve communication. We'll be hearing from Dr. Nicol, as Juliet said, towards the end, who does research on extreme heat, wildfire smoke, and communication. And finally, we'll leave some time at the end for questions and answers. Okay, first off, I would like to invite you to just complete this Slido if you can. We are just trying to find out who's here today. And hopefully you can see the Slido is coming up right now. Okay, awesome. 60% health authority, that's not surprising. We have some provincial government folks, and academic institutions, emergency management, nonprofit organizations. I was actually looking to see whether or not we had any media organizations. Not yet. Wahey, 3%. Okay, that's good. Okay, great. That's great. And I think that works really well for this presentation. So let's keep going. Okay, communication about extreme heat is complex, and even more so during an emergency. We know that climate change caused by greenhouse gas emissions from the burning of fossil fuels and other sources is increasing the frequency and severity of extreme heat events. As emergencies go, heat has usually been under-recognized compared to other emergencies, but this is changing as events become more common. There is no standard definition of an extreme heat event. They're commonly known as heat waves. A general description is a prolonged period of unusually high temperatures, often well above historical averages for a given area, that may pose serious health, environmental, and infrastructure risks.
Very late.
Typically, the duration of an extreme heat event lasts more than 2 or more consecutive days, with daytime highs and nighttime lows exceeding thresholds known to increase health risks. The thresholds are often region-specific. High humidity, low wind speed, and high radiant load from surfaces can amplify the effects of high temperatures. In cities, buildings can block wind and create pockets of trapped hot air, and what's known as the urban heat island effect, which is particularly problematic at night. And what qualifies as extreme depends on local climate norms and population adaptability. The timing of the event we know is really important. We know, for example, that late spring or early summer events, when people are less acclimatized to heat, are more dangerous. Extreme heat is becoming one of our deadliest climate health-related risks in Canada. In 2021, an extreme heat event, also known as the heat dome in BC, caused 619 deaths. The death panel review in 2022 reported that almost all of these deaths were due to indoor heat. Heat is often called a silent killer because it can happen in private spaces, out of sight, and the public and media don't always treat it like an emergency. 67% of deaths were people 70 years of age or older, 90% were over 60, and more than half of these people lived alone. 30% lived with a spouse or family members, only 8% lived in community or assisted living situations, and 5% lived with unrelated friends or roommates. We know we need to prioritize the health of those that are at the most risk from extreme heat. While everyone without access to safe temperatures in their homes, communities, or at their work are at risk, based on what we know from the heat dome in 2021, these groups of people are at increased risk of having heat-related illnesses from extreme heat. Older adults, people with mental illnesses or cognitive impairment, people with chronic diseases, people living alone, who are socially isolated, people who have substance dependence or use substances, people with impaired or decreased mobility, people using certain prescription medications, people with poor physical fitness. These groups of people and other groups like young children and infants need to be given special attention and protection during the next extreme heat event in Canada. Bearing this in mind and thinking about the people around you in your communities, families, workplaces, or indeed yourself, what sources do you think your friends, relatives, other community members, not necessarily you, because you may choose to go to different sources, but what do you think other people are using for information on extreme heat warnings? I'm going to pull up Slido to advance it actually. Okay, it should be coming up now. Oh, and just so you know, the link's in the chat. Okay. Okay, great. These can also be other, traditional media sources, social media, radio, Weather Network, Blue Sky X, social media, big one. Okay, great. Actually, I will be keeping note of all of these. News alerts, word of mouth, specific websites for what to do, Reddit. Okay. All right. Thank you for that. I'm just going to go ahead. Well, in fact, most of those sources were media, of course, and obviously also social media. And media coverage can influence how public audience assess health risks. Media professionals play important roles conveying public health information during extreme heat events. News programs on the radio, news talk radio, TV, online, as well as other programs, long form articles, social media, all together have the potential to inform, educate, and motivate the public before, during, and after extreme heat events. All types of media professionals are key messengers, not just reporters, journalists, and broadcasters, but also photojournalists, editors, assignment editors, producers. We should also add here social media influencers and podcasters, etc. To prepare effectively for extreme heat events, the public needs clear, timely, and accessible information in a few key areas. It's good to know, it's good for people to know, to understand what heat alerts and heat warnings are, how they're issued, and what actions people can take when they see them. We should never assume awareness or consistent interpretation of this information. Communicating about who is more at risk is important, and making this information more visible helps individuals and communities take targeted action. Education about warning signs like dizziness, nausea, confusion, and heat rash can lead to faster intervention and better outcomes. Media can communicate about effective actions people can take, like life-saving steps, like staying hydrated, finding cool spaces, turning on air conditioning, checking in on neighbors, and avoiding outdoor exposure to peak heat during peak heat. And finally, a better understanding of when to seek medical care can be enhanced through media communication. It needs to be clear when symptoms signal an emergency and what to do, especially since people might hesitate to access care or not realize the severity of what they're experiencing or what their loved ones or community members are experiencing. Media plays a very important role in communicating information to the public and pointing to public health sources of information and experts to help prepare the public for extreme heat events. And while some media coverage achieves this, studies show that media can lack the right messaging about extreme heat. For example, a study led by Emily Tetzlaff An analysis of nearly 3,000 Canadian media articles published in 2020, the 2021 heat dome in BC, found that only 23% had heat health messaging aligning with information from government health alert bulletins. Only 13% focused on people who are at the highest risk of heat-related illnesses, and only 4% mentioned common symptoms related to heat illnesses. The study's conclusions were that media and public health professionals should collaborate to craft and distribute health protective messages and general awareness about extreme heat before the heat season and in anticipation of extreme heat events. Inappropriate use of imagery is also an issue when it comes to communicating about extreme heat. In a study led by Saffron O'Neill, on images associated articles published during the 2 extreme heat events in Europe in 2019. The most common image published was people having fun in or by water. This is framing heat as fun in the sun. And this is a representative collage of images from Saffron O'Neill's study. And there's lots of water, there's lots of sun, there's lots of the Eiffel Tower, lots of beaches, but very little of the types of communication that we'd like to see. Yeah, I'm also keeping an eye on the chat, just taking a look right now, but everything seems to be fine. Feel free to drop in questions now or at the end. I'll probably just wait till the end to answer. Okay, in another study on imagery in the media, this is during the 2021 heat dome in BC, content and image analysis of 825 articles revealed that only 16% of images implied heat was a danger, and about half of those depicted human suffering. Only 4% of all the images showed actions to reduce risks of indoor heat, such as air conditioning, seeking cool spaces, etc. And the study conclusions included prioritizing images that align with evidence-based health messaging when disseminating heat preparedness information, and to collaborate with public health to create imagery that is more accountable and inclusive. But unfortunately, even though we know this, it does seem to be a constant issue. So this is from last year in the Vancouver Sun, not to point to any particular media outlet, of course. But the challenge is the image doesn't actually match with the heat warning information here, or indeed of the content of the article, which did actually provide information on who is at highest risk of heat-related illnesses, and it provided practical solutions like seeking cooling centers, etc. So this mismatch is a challenge. And bang, this is yesterday. We had a sunny day yesterday, and now it's raining. So that's BC in the spring. And having reviewed both these articles, this one's from CBC, this one's from Global, and the Global one is about the heat warning in Alberta. This is from yesterday. So both the articles, there's a mismatch in what is otherwise informative, accurate, and helpful reporting. So in the news video on the right, I can't show it because it will slow down our bandwidth, and then we will have audio issues, unfortunately. But it had a lot of great information talking about humidity, the signs and symptoms of heat-related illnesses, who's most at risk, and an interview with an expert about the dangers of indoor heat. But throughout it, there were many cuts to sunny weather, usually by water, inferring people enjoying the weather outside. It's possible these visuals are used to as story indicators of the heat itself to pull the audience in the story, but they are images that are celebratory, and this can send the wrong message. Okay, so there are guidance and recommendations available for media professionals and organizations that are trying to improve how to communicate about extreme heat. And also guidance on communication around climate change attribution. We did a literature scan in last year, the storyline of a silent killer, extreme heat and media communication. We identified some of these resources from agencies such as the Global Heat Health Information Network, Covering Climate Now, Reclimate, etc. And this is, these are on resources that are striving to improve the impact of effectiveness and the public value of extreme heat related reporting. For example, the Global Heat Health Information Network, which is an initiative of the World Health Organization, the World Meteorological Organization, and the U.S. National Oceanic and Atmospheric Administration, recommends framing extreme heat in the larger context of climate change, helping people understand that these events are part of a growing trend. It also is essential to highlight solutions like assets and cooling spaces, using low-cost techniques, etc. Communication should call out inequities, recognizing that older adults, outdoor workers, or those without housing or cooling access are at higher risk potentially. Finally, reporting needs to raise awareness about the indirect impacts like disease spread, health service disruptions, poor air quality, and wildfire smoke risks, which often accompany extreme heat events. And they also offer these practical tips for media coverage of extreme heat. First, start early, aim for pre-season awareness to prepare the public before peak heat hits. Second, expand coverage to include nighttime temperatures and risks in indoor settings, which are often overlooked. Third, use realistic imagery that shows the dangers of heat, along with positive visuals of people taking protective actions. Fourth, balance stories don't just focus on extreme heat events, but also chronic health impacts of ongoing heat exposure. And finally, include a range of local interviews from public health, climate, and community voices to ground stories in relevant and trusted perspectives. Okay, so there are unfortunately knowledge gaps on the perspectives of media professionals who report about extreme heat events in Canada. So to fill these gaps, the NCCEH sought to gather viewpoints from a small subset of Canadian media professionals. We wanted to learn more about how media professionals report on extreme heat, what challenges they face, and what solutions can address these challenges, in particular, how public health can better support communication efforts. So this was a small study based on quality data from 11 semi-structured interviews with media professionals who work in print, digital, radio, news talk radio, and TV news media at local, regional, and national outlets. They participated in this interview. We also interviewed one public health communication professional. We analyzed responses in aggregate and reported them anonymously. We identified common themes across interviews, noting frequency and additional relevant context. But on that, not all interviewees were asked about each specific theme. So a number of respondents who mentioned a theme should not be interpreted as an indication of its overall prevalence. There are also lots of other minor themes that arose that are not discussed here. So here, I'm just seeing in the chat, we will definitely be providing our slides and the report for sure. Actually, We could maybe drop the report in the chat. Oh, there we go. That's great, thank you. But everything is going to be, all the links will be, of all the resources will be in this slide deck that we will provide. So yeah. So here are some of the top line highlights to give you a flavor of how the media professionals that we interviewed approach reporting on extreme heat. So they employ local-centered, human-centered, fresh narratives with unique angles that focus on community resilience and relevance to people's day-to-day lives. Added to this, writers and editors do strive to address narratives for at-risk population by balancing coverage with serious survival information, positive actions, practical solutions, and information about public health and community supports. A widely reported theme was that pitching climate stories follows the same general news criteria. There's also a focus on timeliness, proximity, and relevance, and the topic may be linked to current events or anticipated extreme weather. The long-standing adage, if it bleeds, it leads, still drives coverage. About half of the interviewees reported attending pre-heat season briefings, and some actively monitor forecasts and data from Environment and Climate Change Canada to anticipate and report on extreme heat events. Some interviews said they often consult local experts on from health authorities, hospitals, universities, using accurate data from government sources, health agencies, and scientific studies. Visuals used by interviews were reported to range from authentic to in-house imagery to carefully selected stock or wire photos that reflect the story context. But we obviously also asked about challenges. There were several, and these are sort of the top line ones, the most important themes that came out from these interviews. There were lots of other individual ones as well. Interviews raised concerns. I think this came up in the chat, perhaps, but interviews raised concerns that doom-filled narratives about the impacts of climate change can lead to public disengagement, and recurring extreme weather events contribute to news fatigue. Journalists and other media professionals must continuously find new angles and approaches to communicate about extreme heat, keeping content timely and locally relevant. The challenge is amplified by growing air conditioner and heat pumps among those who use with more resources in the middle class, which dulls public perception of heat risk. Meanwhile, media coverage often maintains a celebratory tone around hot weather, overlooking serious health impacts for people more at risk. Generally, the level of audience interest is low, and this is exacerbated as risks are normalized, making it harder to convey the urgency and inequity of its effects. So this is just one of the quotes I'll read out. The adage is, if it bleeds, it leads. So there's this old reflex that if you put something dramatic or conflict-oriented in the headline, people are going to click on it, but we're finding this is turning people off. So that's sort of in tension with the drive, the it leads driving reporting. And there's a law of diminishing returns when it comes where it just becomes normalized. Okay, so interviews pointed to major challenges in delivering timely and inclusive information. Chief among them was the meta news ban, which has especially impacted communities that rely heavily on Facebook for local updates. Just noting someone in the chat saying real-time access is critical for vulnerable populations and essential services. Also, limited resources, rigid approval processes, and generational differences within public health authorities can challenge content creation. Media outlets serving diverse populations also face language barriers, language and accessibility barriers, delays in translation and access to local voices, limiting the reach of urgent messages. Also, centralized editorial decision-making often sideline stories from northern and smaller communities. Compounding this, misinformation, AI-generated content, algorithm-driven media, and disinformation from vested interests are making it harder for public to navigate complex issues like climate change and extreme heat. All right, so media professionals also reported difficulty in finding diverse expert voices under tight deadlines, leading to using this sort of repeated use of the same sources. Where experts are available, their use of technical jargon can make it hard to convey information in a clear, accessible way. I had to look up the word for what's the jargon word for jargon. A lack of timely, consistent health data, particularly around heat-related deaths, and the paywalls on academic literature further hinder accurate data reporting, data-driven reporting. And on top of that, extreme heat is visually underwhelming compared to other disasters or emergencies, and limited time and budgets may mean relying on images to portray heat as enjoyable rather than dangerous, and this undermines the seriousness of the message. Okay, so just another quote. We like to have good statistics and we like to have the references for them too. So one thing that always comes up is, for example, heat deaths. And heat deaths are measured differently everywhere, as in what's considered a heat death. And a challenge in reporting on extreme heat and anything climate related really is the interviews and actually getting the experts to speak in a way that is accessible. Okay, so we also found out that media convergence is blending the traditional media with digital technologies, leading to a unified information landscape. So like this involves merging of distinct media platforms like TV, radio, newspapers into a single digital driven ecosystem. And due to this, interviews highlighting that time and staffing constraints are a major barrier to sustain coverage of climate of extreme heat. Journalists often are stretched thin, juggling multiple roles and working under tight deadlines, especially as platform integration has reduced capacity across print, radio, TV, and digital. And financial cutbacks and newsroom closures are compounding this issue. As a result, coverage often becomes reactive rather than proactive, with little space for seasonal or pre-event reporting. Even when journalists want to make climate connections, these are frequently missed in the rush to publish. There's also low audience interest in any pre-season coverage. Okay, on to some solutions, which is maybe the exciting part and less gloomy. Interviewees emphasize that audience respond more strongly to people-focused stories that offer hope and practical solutions rather than doom-filled narratives. Sharing local experiences of how individuals and communities cope with heat can boost engagement and credibility, especially when stories reflect important risk factors like age, income, or disability. Media professionals also recommended avoiding using value-related weather terms like good or bad. Trust and reach can be further strengthened by engaging peer-led networks, especially in marginalized communities, and by ensuring culturally respectable messaging from multilingual and Indigenous spokespeople with lived experience. One theme that didn't come through on this, but is important to mention here, is the importance of news talk radio to reach certain audience who are not online. And experts should use plain and non-technical language. And just three quotes here, actually. I'm not going to read them out just in the interest of time, but This one is on translation and having more translated resources. And this one is on the use of sort of communicating through peer networks, through the peers themselves, people with lived experience. And this one is about just regional storytelling, which builds credibility and trust. And having the right experts from Indigenous communities to be able to speak to this. Okay. Another key recommendation was the provision of regularly updated directory of diverse local experts with clear contact details and availability. Journalists also emphasize the need for accessible visuals, personal stories, and real-time data in multiple languages. Centralized searchable platforms like apps or portals could help streamline access to health information. Public health teams could support proactively sharing press-ready materials, offering interview preparation, and creating resources like preparedness toolkits and explainers. These tools are they don't only ease the reporting process, but they help public take action before heat events occur. And this is a great quote. Many journalists have to produce multiple stories in a single day. So if there's an upcoming extreme event, they need quick, reliable information they can easily draw from. It'd be nice if it was all laid out like this, I suppose. All right. And also, to improve climate change and extreme heat reporting, interviews emphasize the need for accessible, factual resources that help journalists connect weather events to climate science without sounding biased. Communications professionals can support by hosting webinars and creating myth-busting content on critical public health topics. Interviewees also stress the role of public health in promoting ethical standards, ensuring transparent corrections, and making reliable resources. So here's another quote, I think the last quote. So there's a piece here too for communication professionals to sign codes of ethics to understand the consequence of not acting in a good way. And this quote is in relation to disinformation, which means false information that is used and intended to mislead, especially propaganda, for example, or other reasons. And there are so many examples of reporting on extreme heat events in the media. And the goal of this project wasn't to review all of these stories, but it would be great to have a repository of them, of the sort of successful examples. There may be other challenges to telling these stories and other solutions we haven't touched on. So just to summarize some key takeaways here. Our interviews with media professionals revealed that media professionals often strive to write and produce local human-focused stories about people at risk with practical tips and positive solutions. They use the best data available and interview local experts when they are available. They often are aware about visuals, the fact that visuals need to frame the story appropriately. They face challenges in doing so, including keeping audience engaged without overwhelming them, difficulty accessing timely and useful data, and reaching all communities, especially with limited time and resources, and a lack of compelling visuals. Oops. Yeah. There we go. The meta news ban is a big challenge, as it also restricts reach, cutting off vital real-time updates in some areas. Participants propose practical solutions such as building networks of local experts, improving access to reliable data, and centering stories around diverse communities at risk. And they emphasize the importance of collaboration between media and public health to deepen climate understanding and fight misinformation. Together, these approaches can create a more accurate, inclusive, and engaging heat health communication that truly connects and supports populations at the most risk from heat-related illnesses from exposure to extreme heat. Okay, one last Slido before we move on to Anne-Marie. Okay, so I know there's lots of things in the chat, but one question I had is, well, we know we do need more collaboration, but what might be a barrier for collaboration between public health and media professionals regarding extreme heat? And just advance here. It's being a little slow. Okay. Does anyone think of any barriers that would hinder collaboration? Risk perception, profit. Okay, any more? Lack of preparation, timelines. Yeah, we'll get that translated. Don't worry. There's some glitch somewhere for that. Don't worry. Organizational structure, no current mechanism for public health, different goals. Sorry, there's scroll back up. Reduction of libraries and library funding, reducing access to quality research, data sharing, misinformation. Yeah. Language barrier, government barriers, bureaucracy, jargon, yes. Media timelines too rushed, definitely. Lack of understanding. I love this gobbledygook. Sorry about that, anonymous. Apathy, yeah. Rural communities, yes. Evidence-based, needs to be evidence-based. We will translate this. All right. Sorry about that. Sorry that's happening. And difficulty accessing reliable data. There's a couple more participants. Lack of footage doesn't exist. Okay, great. This is great.
Sorry, Rebecca, could I suggest for anybody whose key message there got lost in translation, if you want to just post it into the chat, we'll have a record of that. Thank you.
Oh, that's a great suggestion. Thanks, Juliet. Awesome. Okay. All right. So no one else has typed. Oh, one more participant. Different priorities. Okay, well, you can keep plugging away at that. I'll leave it open to add in your say there. I also have a slide for solutions or enablers for collaboration. I don't think we have really time to go over that because I want to give some time for Anne-Marie now. But that I've been thinking about too. So if you do feel like dropping some solutions in the chat for related to collaboration, that would be great. There's more in this report, so feel free to obviously read it and ask me any questions. I just want to thank all the participants for their time, thoughtful contributions, and also members of our advisory panel, also our funding and support by Health Canada, and also thanks to, Elizabeth Loftus, Barb Carlin, Josh Grant, Marie Nicol, Juliet O'Keefe, and Sarah Henderson. And I just wanted to raise awareness about a product we are developing right now, which is a video on extreme that covers our health checks during extreme heat events checklist. So that's coming soon. I'm excited about it. So you'll be hearing about that soon through our e-news channel. Thank you for that, and I will pass it on. I will stop sharing and pass it on to Anne-Marie.
Thanks very much, Rebecca. And yeah, I think it's a good time to put questions for Rebecca in the chat. I'm going to be really quick. When I talked to Rebecca about this project and what she was doing, can you see my slides?
Yeah, we can see them. Thank you.
Okay, thank you. I was struck by both how timely important this work is, and also by some of the challenges, very real world challenges that it addresses in the kind of work that I'm doing. So I work at Simon Fraser University, and I'm also part of the BC Lung Foundation. We have a collaboration called the Breathe Project. And just in a nutshell, across British Columbia, we're working with people who are more at risk from extreme heat and smoke to talk to them particularly about how to stay safe during. So it's a very community engaged research project. In part, we go to communities and we teach people how to make DIY air cleaners, We talk quite a bit about the impact of wildfire smoke on health. The lady with the red hair is our oldest participant. She's 100 years old. After people come to the workshops, we invite them to take part in a follow-up survey. So far we've spoken to 140 people after about 6 to 8 months after they've made our units. And we started to ask them about extreme heat as well as smoke, because what we found when we went to communities, and a lot of these are communities outside of Vancouver, this is in Interior Health in particular, and this year we're going to Northern Health. But when we get into communities, what we get is a lot of questions and a lot of on the ground anxiety by residents about heat, smoke, and then what happens when they happen together. And I think that from a media point of view, the co-occurrence of heat and smoke is incredibly important because the messaging becomes quite nuanced. And one of the collaborators on our Breathe project is Dr. Stephanie Cleland. So she recently released this study that shows where we're expecting to see, at least in this province, both heat and smoke at the same time. And again, it points to just how important it is, because the strategies that you use if you have wildfire smoke exposure are different. Stay inside, keep your doors and windows shut, are very different from what it should be if you're experiencing extreme heat, in which case you want to stay cool. And then helping people prioritize risk. So now we say, if it's smoky, that's important, but if it's very hot, that's life-threatening. And so that's a lot to give folks on the ground to try and help them contextualize and better understand what their risks are. And I think this is a big challenge for people who work in communication, is that we have messaging for heat, we have messaging for smoke, but what happens when they're both together? And the BC CDC does have resources for these. They're very high level, though. They're not lay resources. And I think it takes journalists and people in public health to be able to relay these messages in a way that helps people make sense of them. So again, this summer we were provided funding here in BC to be able to take our work to the north. And what we've been able to do is tailor these resources that include things about extreme heat. So this is something that we've been handing out in Prince George, and I think Lisa might be on the line. So hello, Lisa, and thank you again for helping out with this. So we're providing people with these sort of handy tips, but what we learned along the way is that many people don't consider themselves at risk. And the older people were, the less likely they were to be concerned about heat. It's just a hot day. People are more concerned about smoke, I think, because they can see it. And I went to look in the literature about, what do we know about co-exposures to heat and smoke? And there isn't a lot about what perceptions are about these exposures. And then, how do we address these? So we've started a follow-up study. It's still proposed because we're still going through the ethics process. But we are proposing a study where we want to actually ask people questions about, do you think you're at risk from extreme heat? Because people aren't going to pay attention to messages if they don't feel that they are related to them. So we can craft all the media messages we want, but if our audience doesn't understand that they are at risk, then they're not going to pay attention. They're not going to attenuate to messaging that is directly for them. Rebecca talked about Emily Tatzloff's work. She did a great set of studies. She's in about 5 now on extreme heat and communication. So I encourage you to look up her recent publications. But other Canadian researchers that have looked at extreme heat do also suggest that the older people are, the less likely they are to believe that heat is a problem. And then in the case of Hansen, that was a Quebec study, they found that people actually lack capacity. So the older they are less likely to consider themselves at risk. And then issues of confusion and dehydration often even make things worse. So once it's very hot, people lack the cognitive capacity to be able to make decisions about what to do about their health. So again, the key here is, how do we get people to orient even to understanding what those messages are? And so acknowledging that risk perception is important is kind of the first step. So we have this proposed pilot study that we're hoping to start in New Westminster, but expand outward, where we're going to ask if knowing what the temperature is at least, or how hot is too hot, if we can get seniors to fill out this form, if we can get them to pay attention to what the temperature is inside their home. So we're going to propose to study people who don't have air conditioning. We're going to give them big, large format thermometers. We're going to talk to them about, how hot is too hot. and then see if people will check every day, and then see if that changes their perception. If somehow clocking what your temperature is indoors changes your perception about risk or your understanding of whether or not you're at risk. So we hope to follow them up over this summer, and then interview people at the end about their experiences. So I think that's it for me. That's all I wanted to say. But I just again thank Rebecca very much for the work that she's done here, because working in communities, I can't tell how important it is to have answers to these questions about how best to communicate extreme heat, because I really don't think we're there yet in helping both the media and the messaging get to people who really are most at risk.